नमस्कार। फार्मालोग
नमस्कार।
के समस्त दर्शकों का आज वर्ल्ड फार्मासिस्ट डे के इस अवसर पर फार्मालोग द्वारा आयोजित लेक्चर सीरीज के 8वें लेक्चर के अंक में आप सभी दर्शकों का मैं अमित झा, कोऑर्डिनेटर टीम फार्मालोग, हार्दिक स्वागत और अभिनंदन करता हूं। और आज लेक्चर नंबर 8 के जो हमारे स्पीकर हैं आदरणीय प्रोफेसर जयबालन गोविंदास्वामी सर, जो कि हमारे अलवर कॉलेज ऑफ फार्मेसी अलवर में प्रिंसिपल के पद पर कार्यरत है, आज हमारे बीच उपस्थित है। सर्वप्रथम आदरणीय सर, आपका बहुत बहुत स्वागत है फार्मालोग के इस मंच पर, और एक बार पुनः आपको टीम फार्मालोग की तरफ से बहुत सारी शुभकामनाएं वर्ल्ड फार्मासिस्ट डे के अवसर पर। और जैसा कि आपको मैं बताना चाहूंगा कि आज वर्ल्ड फार्मासिस्ट डे के अवसर पर सर की तरफ से जो टॉपिक है वो है फार्मासिस्ट रोल इन AMR प्रिवेंशन एंड कंट्रोल, जिसके बारे में आज सर इस विषय पर प्रकाश डालेंगे और हम सभी को अपने अमूल्य मार्गदर्शन से लाभान्वित करेंगे। और इस क्रम में मैं आमंत्रित करता हूं आदरणीय सर आपको, कृपया आप अपने विषय पर प्रकाश डालें।
थैंक यू सर।
धन्यवाद सर।
थैंक यू सर। थैंक यू सर। प्रेजेंटेशन शेयर कर सकते हैं?
जी प्लीज।
सर फुल स्क्रीन आ रहा है?
जी सर।
Okay. Good afternoon, all of you. I am Professor Jeyabalan Govindasamy, Principal of Alwar Pharmacy College. I wish you all happy World Pharmacist Day. Today, all the pharmacists are united for a healthier world in action. So, with all the theme, we love to, first of all, wish all of you a very happy World Pharmacist Day. Today, I have chosen the topic, pharmacists, the role in AMR prevention and control. Actually, AMR is a well-known menace problem of healthcare department, antimicrobial resistance. We all know very well about that. And I want to share some important points that the pharmacy students and pharmacists can take care so that the AMR can be reduced, minimized, and we can have some potential antimicrobial substances ready for use in any serious infections. So these are the agenda. We'll see something about the microbial infections and AMR and its menace. Then and the antibiotic discovery research and the role of pharmacist and healthcare team in the minimizing AMR. So we'll summarize it and we'll finish with the acknowledgement. So this is our agenda, and in Britannica it is given that the infectious disease in medicine is a process caused by an agent, often type of microorganisms. The microorganisms are, we can directly say, the foreign proteins. They just invade into the body through uh, any mode, and they want to have some living organism for their regeneration and multiplication. So this is what they want. Their protein wants to enter into the body, either by direct contact or any through by any means, like waterborne, like we what we say, waterborne disease, vector-borne diseases. So these are all the way of the microorganisms to get into the human body. When the foreign proteins or the proteins of the microorganisms get into our physiological system, they get into enter into our cells, and they make our cells as the industry for their reproduction or regeneration. So this is the way they multiply inside our body. They have a living system for their synthesis of new progeny. So they develop, they multiply, they cause the infection. So to control the infection, we have a very good system in our body, that is immune system. That immune system, even right from the skin, that prevents the entry of microorganism into our body. That is the largest organ of our body also, that controls the entry of microorganisms into our body. Even then, when the microorganism gets entry into the system, in our circulatory system, we have the white blood cells, mast cells. They that video is going on. You can see how the mast cells are capturing or engulfing the microorganisms or bacteria from they avoid them to multiply. They protect our body by engulfing all the bacterial cells. So this is the way our immune system starts working right from the beginning. Right from the beginning, they just want to capture it. Even then, if the microorganisms escape, finally, when all the immunological activities of the body fails, then the infection will prevail. When the infection is prevailing, we need some drug to control the growth or the the production of microorganism inside our body. So we need to have some chemical drugs to control the microorganism infection. So we need to have some antimicrobial drugs. So when the antimicrobial drugs are used, these antimicrobial drugs, either they can prevent the protein synthesis of microorganisms, they may prevent the nucleotide synthesis of the microorganisms, or the cell wall synthesis of the microorganism, whatever it is, they want to just stop it. So these are drugs, when they are used in a wrong manner or in a over level, they may the microorganisms may develop a resistance. They can escape from the particular antimicrobial drug. That is called antimicrobial resistance. That resistance is developed inside the microorganism. That is very uh, alarming condition for humankind and other living organisms, because we cannot control the infections and their uh, pharmacological effects caused by the infection without any drug. So this is the way we are going to see what are the infectious diseases still now prevailing in India. We have major diseases in the list, and it starts with tuberculosis, leprosy, malaria, HIV, dengue, encephalitis, filariasis, black fever, monkey fever, hepatitis, polio, pneumonia. So these are the infectious diseases mostly prevailing in India, and some of the diseases are also there, which are giving this what we can say, they are causing the death of the people uh, by the infection. So once they are the microorganisms are becoming resistant to antimicrobial drugs, then they are more effective to affect the human body. So the statistics says that 1.2 million people were died in the year 2019. 1.2 million people have died because of antibiotic resistant bacterial infections. That is a report of Lancet. And the Lancet, one more Lancet report in 2-3 days back, that stated that India is the number one in consuming azithromycin during this pandemic time. While they are taking the statistics across the globe, so they have calculated that India has consumed the largest quantity of azithromycin during this period. So this much consumption of antimicrobial substances will definitely lead to resistant bacterial or microbial strains that cannot be controlled when they become a pandemic or endemic or whatever it is. So this is the problem with the microorganisms and antimicrobial resistance. So one study that shows that in the Indian COVID situation, the total number of deaths has been reported as 3.4 million, but in some other report it may be estimated as 5.4, whatever it is. But if you see, every year about 1.22 million people are dying because of antibiotic resistance bacterial infections, then COVID is not a larger one. For the 2 years, 3.1 million, it's not a larger number. So this is very alarming that the antimicrobial resistance has to be controlled, and that is in the hands of the healthcare team. We are responsible, and we are responsible for the control and minimizing of antimicrobial resistance development in the microorganisms. So how can we, what can we do? So we will see some of the ideas, and we will discuss in this presentation. And it is also estimated that 10 million annual deaths of antimicrobial resistance will be by the year 2050, one report says. So this is very alarming situation. So this is the point where we have to concentrate, we have to look into seriously. And and then there are some other diseases in the list also. Zika virus, Nipah virus, these are all some viral diseases, chikungunya. So there are number of infectious diseases are there. So we have to be very, very careful. There are, and in the tuberculosis, there are variety of resistant strains are identified, multi-drug resistant and extensively drug resistant, total drug resistant. So we in India, where we have some 12 TB patients in the year 2012 in the Hinduja hospital, means there is no drug to treat them in India. So this kind of tuberculosis patients, when they rise in the number, they will cause a very, very huge number of death due to tuberculosis. It was estimated in the year 2016 that is 4,23,000 for 1 year, means 1,158 per day, or we can say per hour, 48 people, around 48 people per hour were dying due to the TB. So this is very uh, uh, important thing to think about. Now, the menace of these communicable diseases and AMR, we are giving the same slide. It is repeating, sorry. What are the factors that have caused the antibiotic resistance? It has been reported in on the NIAID. That is one of the most important thing is over prescription of drugs, antibiotic drugs. Antibiotic drugs are prescribed like anything in our country that we know, but this can be controlled, or this can be uh, given in a notice. This can be taken to the notice of the physicians in a very serious manner, so that we can specifically prescribe, we can get the prescription for the particular diseases. We will not go for any over antibiotic usage. So I have recently seen some prescriptions where there is one there are two narrow spectrum antibiotics and one broad spectrum antibiotic along with the other drugs. So there are three drug combination is used for a simple flu-like infection. So that is not necessary. People were afraid of this COVID pandemic and all. At that time, they started using so many antibiotic, anthelmintic drugs. So they started using as per the prescription they were getting through the WhatsApp, email, also. So over prescription of antibiotics will definitely lead to antibiotic drug resistance. And patients, those who are not finishing the entire antibiotic course, if the drug has to be taken for 5 days, it has to be taken for 5 days. It cannot be stopped in 1 or 2 days after getting the decreased symptoms. It is not at all right manner for completing the course, because it may cause antibiotic drug resistance. And overuse of antibiotics in livestock and fish farming for their safety may cause the resistance developed. The resistant microorganisms will be developed in the livestock and fishes that may infect the human beings. So the over usage of antibiotics even in livestock and fish farming is also a problem. And poor infection control in healthcare settings. The one more thing we have to take care, that is the hospital borne infections. So those infections which are obtained by the patient during their stay in the hospital is very dangerous than the actual infection that they were getting and treating it in the hospital. And poor hygiene and sanitation in the hospital as well as in the residential areas is also a problem. And absence of new antibiotics being discovered means for every new disease, for every new microorganism, we cannot get every new antibiotic drug, because the antibiotic drugs or antimicrobial drugs which are existing in the market are, we have a plethora of antibiotic substances, and these substances are uh, they can be used for several diseases, but we are minimizing the spectrum of usage of those antibiotic drugs, and we need to have some more new antibiotics for the infections that are being arrived in the society. So the absence of new antibiotic drugs being discovered is the reason, but for every drug from the table to desk to market, it costs more and more money, time, energy, and so many things. So it is not an easy thing that we can say every time a new antibiotic. It's not possible. We have to either repurpose some other antibiotics which are useful, or we have to adjust with the existing antibiotics. So this is very uh, important condition to watch into by the healthcare professionals. And this is also one of the reason that improper disposal of medicines, it's a social driver of AMR. And public, they are using antimicrobial substances. They are getting it from the hospital, and they are using it for 1 or 2 days, 3 days, and after getting the symptoms relieved, they stop using the drugs, and they leave it behind. That will be expired in the home, and sometimes later they throw it into the public sewage. That can cause a very serious antimicrobial resistance that may also cause, we can see, this is also a cause for the social driver of AMR. So this is some study has been reported that for simple fever and cold, people started using antibiotic drugs, and they consumed without any symptom. 72% of 72.3% of the people have consumed it for simple fever, and 57.8% of the people have consumed antibiotics for simple cold. But in the same group, only 23% of the people have completed the entire course. Remaining 77 people left it behind. And only 40% of the people in the group 2, those who have used it for cold, have completed the course, and remaining 60% left it behind. And almost 75% of the respondents just throw their unused expired antibiotics in the sewage. This is the one of the cause for the development of antimicrobial resistance in the microorganisms. So the other possible ways that is like a mutation, genetic material transfer, and natural selective pressure, the societal pressure of the microorganism for the what we can say that survival of the fittest. So the microorganism wants to survive at any cost. So they want to change their system, change their the proteins, so that protein synthesis cannot be affected by the particular antibiotic drug. So that is the way they want to escape from the antimicrobial drug. So they want to develop the resistance, though they develop also. The what we use is the antibiotic drugs. Sometimes we inadequately diagnose it and prescribe some antimicrobial substances. Sometimes for the prophylactic use, we use some antimicrobial substances, some like hospital antimicrobial usage, some prophylactic for before any treatment or therapy, or those who are using antibiotics in agriculture feeds. These are all the cause for antimicrobial drug resistance in microorganisms. And what we can do means, what are the roles of individuals, what are the roles of healthcare professional, and what are the roles of policymakers. We are what we can do, only use of antibiotics whenever it is required. Individuals can make it as a thumb rule that whenever it is required, it can be used, not always. And never share any leftover antibiotics to other one in the family. If the number one person has some cold or fever, like some doctor prescribed antibiotic, 2 days they use it, the 3 days dose will be remaining, and they are using it for the number two in the family. So that is not like sharing of antimicrobial drugs, that will cause the resistance development. And sometimes uh, we can prevent the infections by proper hygiene, like hand wash, food hygiene, sex hygiene, social distancing from sick, and whatever the possible ways, even the immunization by vaccination. So all these we can prevent the microbial infections in our body, so that we need not go for any antimicrobial drug usage. We can prevent the usage of antimicrobial drugs, and we may try to prevent the development of antimicrobial resistance. The role of healthcare professionals, we have to avoid the infection by sterilizing the hands, instruments, and areas when the patients are coming one by one into the chamber, or when they are in the ward, when they are in the outpatient wards. So whatever it is, we have to make a hygienic environment for the patients, and we have to prescribe only the necessary antibiotic drug. And we have to report for AMR also, what are the microorganisms, what are the infections which are resistant to particular antimicrobial drugs. And we have to counsel the patients and the caregivers about the antimicrobial resistance and their hazards. And we have to tell them that these are the ways that we have to follow to prevent the infections. Then the policymakers can do, they can ensure a robust national action plan for this antimicrobial resistance development. They can improve the surveillance of antibiotic resistance infections, and they can strengthen policies. They can control the supply and usage of antimicrobial substances in a particular area for a particular season for a particular disease. So they can regulate it, and promote it. They can appropriately use certain antibiotics. They can create awareness programs for antimicrobial resistance. So this is the like antibiotic consumption data from the supply chain to the prescription dispensing and appropriate use. This can be antibiotic use data can be very well monitored, and they can be controlled by the regulators. So we can also adopt this aware. This aware is nothing but the 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 how to adopt this aware. The website gives complete information about how to use sensibly these microorganisms. They have divided the antimicrobial substances into three groups. One is access group, the second one is watch group, and third one is reserve group. If you see the group of antimicrobial substances in access group and watch group, you will wonder. And in reserve group, how people are using irresponsibly all the antimicrobial substances, that we can come to know when we see the list of the drugs. This is aware. The aware is the first group of aware is the name. Access is the first group. Access means that can be commonly used for the infections, and there are some 20-25 drugs given, antibiotic drugs, and these drugs can be used, that are given in the WHO essential medicals list. And this is in the WHO toolkit also. We can see what are the drugs are listed in the access group. This can be used for the infections which are commonly found in the world. So we can prefer any one of the antimicrobial substance according to the infection and the usage. And this is the access group. Aware. In aware, watch group is there. Watch group is the group includes antibiotics and antibiotic classes that have higher resistance potential. That includes most of the highest priority agents among critically important antimicrobial agents. In this, there is the first drug called azithromycin. That was we were discussing about this drug little earlier. India was the first drug in consuming more quantity of azithromycin, but azithromycin is in the watch group. We cannot readily use it for the bacterial infection randomly. There are some drugs which can be accessed in the first line, and if the first line access group are not working, then the drugs which are given in the watch group can be chosen for treating their infections. So this is the list that is given in the WHO practical toolkit. You can anyone can see this. So aware, they are giving three groups of antimicrobial substances. One is access, the second one is watch, and the reserve group. The reserve group is the last option. Last option means if we have nothing to do, only this drug can save the patient from the infection. At the last point, they can go for this. Otherwise, they should not touch it. This is the reserve group of antibiotics, and these three groups, access, watch, and reserve. If you see, we are using very commonly the watch group antibiotics, even sometimes, uh, especially the healthcare team members. They are easily using this even reserve group of antibiotics for their infections and their treatments. So this kind of usage of reserve group antibiotics may cause the microorganisms with resistance. And what can a pharmacist do for this? Then it is by antimicrobial stewardship program. Something like we can uh, give some suggestions by learning about the antimicrobial resistance and all. we can get some data and we can report the feedback. So we can give some education and training also. We can surveil the usage. So this kind of program can be conducted to assess and advise the healthcare people to how to use sensibly the antimicrobial substances and how can we prevent the usage of prevent the antimicrobial resistance development in the microorganisms. So we can set a goal for changing the use of smart way of antibiotics. Smart is specific, measurable, achievable, relevant, and time-bound usage of antibiotics. So we can achieve this by conducting this antimicrobial. We can give it to the students also. They can go and they can get access to all the healthcare team members, and they can give the suggestions, like they can say they can change the usage, smart usage of antimicrobials. They can determine what quantitative measures that can show improvements, and how can we change the use of this microorganisms. All these are given in an antimicrobial stewardship program in the WHO practical toolkit. Some of the students, even in their final year project, we can ask the students to do this kind of programs in the general hospitals or in the uh, hospitals which are in the tie-up with the institutions, so that they can come to know how randomly the antibiotics are used and how it can be prevented, how it can be useful for the reduction of antimicrobial drug resistance. So these by conducting this antimicrobial stewardship program, so we can something uh, do something to the society by minimizing the overprescribing over antibiotics, overly broad spectrum antibiotics, like the watch and reserve group antibiotics used for the treatment of simple prophylactic or any treatment of simple infections, and unnecessary combination therapy, like I was saying earlier, two narrow spectrum and one broad spectrum. So there are three antibiotics in a group. So combination therapy is prescribed by the physician for the sake of safety and prevention of infections. So these kind of activities can be minimized, and the pharmacist can very well discuss the points to the physician, that these prescriptions can be reviewed by the physician carefully, so that the usage of watch and reserve group antibiotics can be avoided, so that that can be reserved for some other major infections. And wrong antibiotic choice, that is to be avoided. Wrong dose, wrong dose interval, wrong route, wrong duration, and delayed administration of drugs. These are all uh, avoidable one if the the healthcare team sit and discuss about all these points, and if they conduct the antimicrobial stewardship program, and they come to know that this is the report and this way we have to proceed for control the usage of antimicrobial substances. And by the by the study by the antimicrobial stewardship program, they can do it very well, and for the interest of the society and the future, we can reserve some antibiotic substances active to all the infections. So to design one more thing is also there in WHO, that is KAP survey, knowledge, attitude, and practice survey, that we can give the advocacy, communication, social mobilization for AMR. That is, we can give advocacy to the people, and we can communicate to the healthcare professionals, and we can get the knowledge to the people who are concerned with this, and we can prevent this by this survey we can prevent the development of antimicrobial drug resistance. So these are all some the point of actions that can be involving the pharmacists and pharmacy students in the hospital system. We can give this awareness and knowledge sharing to the what I can say, the healthcare team, the patients, the caregivers, the attendants, and the common public and everyone, so that we can uh, transform the knowledge. We can inform the people about the antimicrobial substances, the limitations in their usage, the limitations in their availability. So there are number of antibiotics which are used in the market, but when we see the different type of infections and their resistance developing in the pace is very alarming. The pace of antimicrobial drug resistance development is very alarming, and we don't have that many number of antimicrobial drugs in the market to cure all the diseases of all the people. So to save people in the future, we should have to sensibly use this antimicrobial substances, and we can uh, take the first step in controlling and preventing this antimicrobial drug resistance. As a pharmacist or a pharmacy student, we have a huge responsibility, and we have to uh, take all the possible ways to create awareness to the healthcare team and common public to realize the future world needs antibiotics, and for the future pandemics, let us reserve some antibiotics for the future. And apart from that, there are lifestyle diseases. So there are hit from both the sides. So the human beings are affected one side by infections, pandemics, and all. The other side, they have their own lifestyle diseases like diabetes and all these things. So to control the the antimicrobial drug resistance development will be a very good step for the healthcare profession. This is my presentation. Thank you very much, sir.
थैंक यू सो मच सर, आपके अमूल्य शब्दों से आज हमारी युवा पीढ़ी को, हमारे नए शिक्षक गण को बहुत सारा ज्ञान और मार्गदर्शन प्राप्त हुआ। और इस अवसर पर आपके द्वारा दिए गए विचारों से लोग अवश्य ही लाभान्वित होंगे, ऐसा हम अपेक्षा रखते हैं। और आपका बहुत बहुत धन्यवाद करते हैं सर कि आपने अपने बहुत ही व्यस्ततम कार्यक्रम से समय निकाला और हमें फार्मालोग के मंच पे दिया। एक बार पुनः आपको धन्यवाद, और पूरी टीम की तरफ से आपको एक बार पुनः शुभकामनाएं वर्ल्ड फार्मासिस्ट डे के अवसर पर। बहुत बहुत धन्यवाद सर।
थैंक यू सर।
थैंक यू सर। जी प्रणाम।
I was in time, I think. Thank you.
थैंक यू सो मच सर। प्रणाम सर। प्रणाम सर।
Thank you. Shall I leave this?